Hi everyone, it's Makoto Trotter. I'm your naturopathic doctor and I'm here to talk to you about irritable bowel syndrome, and I'll give you 5 tips to help you with your irritable bowel syndrome issues. Irritable bowel syndrome is considered a diagnosis of exclusion. And what that means is that we can't really point our finger on exactly what the problem is. Let's say if you did a colonoscopy, it would likely show that everything is normal because we're just trying to look for structural abnormalities in a colonoscopy, and you wouldn't actually see it because it's a functional problem, meaning it doesn't function properly, but that's not something that you can visually see. But we know something's wrong because your gut's not working properly. It could be IBS D, irritable bowel syndrome or IBS. D means diarrhea, so it could be on that extreme. On the other hand, it could be irritable bowel syndrome C, constipation. And then the other extreme is that it can be unpredictable, IBS A, or alternating, so it could go from diarrhea to constipation, back and forth. What we want to do is we want to get it away from those extremes, normalize it so the bowel movements are normal, so that the abdomen isn't uncomfortable. We don't want to have discomfort, we don't want to have bloating, we don't want to have irritation or tenderness, nausea, vomiting, heartburn. Any of those things can be part and parcel of irritable bowel syndrome. So my first tip with irritable bowel syndrome is to work on the diet. Of course, that's obvious, but what do we do with the diet? There's all these extreme diets these days. You can go from one extreme, from keto or even carnivore, take it a step further. On the other hand, you have plant-based vegan diets, all raw. And in either of these situations, they might not help your digestive problems. So we want to find something, again, that's somewhere balanced and in the middle. Now, of course, there's ethical issues around eating meat. Don't have meat. But the raw food movement, part of the problem with that is that raw food is difficult for our digestive tract. Think of our digestive tract as an Instapot. An Instapot pressurizes food, heats it up, breaks it down so that it's easily broken down. But when our gut is compromised, that Instapot isn't working well. So we need to use our Instapot, or it could be a slow cooker, or it could just be your big pot in your stove, make stews, use pans in the oven to make baked goods, grilled foods. Once you heat those things up, it's easier for our body to take those nutrients or those food particles in that are already pre-digested through cooking, and then our body's able to assimilate and absorb those nutrients more efficiently and not create gas when there's larger particles that we can't properly digest. The second tip, make sure you're getting adequate sleep. A lot of us don't prioritize our sleep anymore, and that could be because of our jobs. It could be from chronic stress. It could be from anxiety. And sometimes we normalize our lack of sleep or our restless sleep. Maybe we think 6 hours is enough because we're functioning. We're functioning, but it doesn't mean that it's proper for us. Of course, we give our body something, we'll adapt it, whatever we give it, and then you'll be okay with 6 hours of sleep, but it's not okay. So we have to find, there's certain cases where it's okay when there's a genetic component. There's some people that don't need as much sleep, but most people do need much more than that. It's usually a bell curve. Okay, so prioritize sleep. The third thing is exercise. Sometimes this is the missing piece of the puzzle. For my patients with digestive problems, we get them 80-90% better. To get that last 10% better, we have to incorporate exercise if it's not being done already. Exercise helps to stimulate the proper brain chemicals, neurotransmitters, or hormones in our body to help normalize everything in our body, including our digestive tract. So sleep, let your body rest, heal the tissues, and exercise so that when you're active, then your body's doing everything it should be doing. Okay, the fourth tip would be some basic supplements. Now, some people come in taking a pile of supplements, and of course, if you are having a handful of supplements with every meal to help your digestive problems, that's going to go backwards because that's going to be difficult to digest. So we want some basic supplements, which can be very helpful for digestive problems, but we don't want too many either. So my 2 favorites that I find are the ones that are supported by research and also help my patients the best would be, the first one being probiotics. This is by a company called NFH, which does make good quality products. And I like their product because it meets my criteria. It should be 8 to 10 strains of bacteria. Make sure you're getting a good variety. If it's in the refrigerator, at the health food store, wherever you're purchasing it from, that gives you an idea that there's probably going to be more types of bacteria. But take a look at the back label. Second thing, make sure it's enteric coated, meaning that the capsule will not dissolve in the stomach acid. It'll open up later on in the small intestine, which is where you want those good bacteria to go. And then the second supplement that's helpful is a powder. It's called L-glutamine powder. L-glutamine is an amino acid. We take it as a powder because we need a higher dose. And L-glutamine, think of it as a fuel source for those enterocytes, the cells lining our digestive tract. So you take glutamine and a little bit of water, take it sometime in the evening when your stomach's empty so it can make contact with your entire digestive tract. That's helpful for strengthening and rebuilding your digestive tract. Okay, but with supplements, do make sure you talk to your doctor, your naturopath, your medical doctor, if these supplements are okay, and make sure they work for your particular health condition and they don't interact with some other health condition that you have or medication that you're taking. fifth thing, the last thing that can be very helpful, besides doing regular conventional testing, which, like I said, probably a colonoscopy, maybe an ultrasound, they'll say, oh, there's a lot of gas. We will look and everything's showing normal. That's typically the case in irritable bowel syndrome. But you know things aren't normal. So there can be certain tests that can give you more information. Comprehensive stool test with parasitology is a test. It comes in this little box. It's a 3-day stool collection. It's not lovely to do, but it also gives you a lot of information. So from those 3 different stool samples, you'll get an assessment of microbiology, meaning the good bacteria levels in your gut, the bad bacteria levels in your gut, potentially yeast levels that might be in there, or parasites. We want to rule those out. It's looking at markers for digestion, absorption, inflammation. It's also looking at the antibodies in your GALT, or your gut-associated lymphoid tissue. So we're looking for antibodies being produced that could be either too high or too low in irritable bowel syndrome, and that can cause problems. You can overreact to foods, or maybe you're not responding properly to foods. So all of these things are being investigated, along with ruling out blood, checking the pH of your stool, and also the short-chain fatty acids, which are the breakdown products of fiber, which feed your gut, just like glutamine. Okay, and the other test that I find is very helpful, there's all sorts of tests that are available to do, but this is the one that gives a lot of good information. It's just it's called a food sensitivity test. It's basically these 5 little dots. You have to fill it with blood, which is just from a finger poke. That same sort of thing the diabetics would do at home. Finger poke, a few drops of blood, put it onto the blotting paper. It's measuring antibodies to certain foods in your diet. So antibodies to certain foods, if they're too high, basically means if you're eating that food, your body's overreacting to it, creating inflammation, and your gut's not digesting them as well as it should. Big 3 being gluten, dairy, and eggs, but it's also looking at a lot of other foods. So it helps to kind of break down, okay, which type of foods are actually the problematic foods for you, rather than just guessing with different diets that are cookie cutter. So those are my 5 tips, the most important things for irritable bowel syndrome. If you want more information, there's more information on our website about digestive problems and how to help you out from a naturopathic perspective. Thanks for listening, and hope your gut feels better soon.